Hi, my name is Saeed Monterey. I'm a doctor of physical therapy and board certified specialist here at Revive Physical Therapy and Wellness in Tempe, Arizona. And in this video, I want to talk about neck pain and stiffness and headache due to hypomobility and how physical therapy can help. Hypomobility is just excessive stiffness within our joint. And all our joints in our body has within normal joint play to it. And this basically means movement that is considered normal for our joint to function and do what they're supposed to do. If this is compromised, it can lead to pain, stiffness, or instability. Now with hypomobility, we're gonna be focusing on excessive stiffness. So let's dive into the neck. Over here, I have a spine model. Up here is the skull, the head, down here is the pelvis. This purple part here is the neck. It consists of 7 cervical vertebrae and 6 intervertebral discs that's between each vertebrae except the first 2. Now the neck, along with the back, has a lot of joints in it. It actually has 2 joints in each side of each vertebrae, one at the top and one at the bottom. This helps connect the spine with all the 24 vertebrae it has from the neck to the low back, the lumbar. This allows our spine to be flexible and mobile. Now, however, if hypomobility sneaks in due to degeneration, arthritis, history of trauma, bone spurs, this can lead to stiffness in one of these joints. So if hypermobility or excessive stiffness happens in one part of a segment of the spine, let's say for this example, it's down here, the bottom part of the neck. So if this part doesn't move, your body's gonna compensate because it knows it has to move. It's just gonna move in another area that's easier to move. Let's say it's the mid part of your neck. So it starts to move more in this middle part of your neck and less in the lower part of your neck, which causes even more stiffness down here. This stiffness then can cause a pinched nerve. If a nerve is pinched, it can lead to radiating pain or numbness or tingling. If it's the upper part of the neck, it's gonna cause that headache that starts in the back of your head and moves forward by your eye in this ram horn pattern. If it's in the bottom of your neck, it can cause pain that emanates down into the shoulder blade or sometimes all the way down in your arm and your fingers, numbness and tingling too. So here at Revive Physical Therapy and Wellness, we use a multi-dimensional approach to treat this, which includes joint mobilization, joint manipulation, and therapeutic exercise. We do this because research has now shown that using this multi-dimensional approach is more beneficial than just using exercise alone or just hands-on treatment alone. Now, let me explain what these techniques are. Joint mobilization is a treatment used to target the joint to improve mobility and decrease pain. You can think of this like a massage for your actual joint, or in this case, your spine. It allows repeated stretching to that joint and mobility for a prolonged period of time that helps remodel it. You can also check out my video called Mechanical Pain in the Recovery Process to learn more about remodeling. Joint manipulation is also another technique that we use that targets the joint to improve mobility and decrease pain. It's a quick impulse in mid-range with proper mechanics to help free up the joint. A lot of patients might hear or feel a pop or a click, followed by decreased pressure and improved mobility. And then after these hands-on treatments and the benefits of these hands-on treatments are assumed, we can then add therapeutic exercise, which is basically movement patterns aimed to improve function and decrease pain. And it's shown that adding exercise after hands-on treatment can help maintain the gains achieved with our hands-on treatment, but also improve them. So here at Revive Physical Therapy and Wellness, we rely on world-class hands-on treatment to make the difference. Our therapist puts our hands on the patients to improve the movement of the joint or the tissues, and then implements proper exercises to make sure those gains are maintained. Please contact our office to see how we can help you. And please share this video and subscribe to doctorsconvey.com for my upcoming videos.